Cystic fibrosis makes it harder to move air in and out of the lungs and clear mucus from the airways. Thick mucus in the lungs and sinuses provide an ideal breeding ground for bacteria and fungi. People with cystic fibrosis may often have sinus infections, bronchitis, or pneumonia. Because the lining inside the nose is inflamed and swollen, it can develop soft, fleshy growths called polyps. Teenagers and adults with cystic fibrosis may cough up blood because of thinning of the airway walls. Air collects in the space that separates the lungs from the chest wall, and this leads to a normal thorax, which is more common in older adults. Over time, cystic fibrosis can damage lung tissue so badly that it no longer works. Lung function usually worsens gradually and eventually can become life-threatening. People with cystic fibrosis may experience worsening of their respiratory symptoms such as coughing, shortness of breath, for several days to weeks. This is called an acute exacerbation and requires treatment within the hospital. Digestive symptom complications include thick mucus that blocks the tubes that carry digestive enzymes from your pancreas to your intestines. Without these enzymes, the body can't absorb protein, fats, or fat-soluble vitamins. The same goes for the pancreas, unable to produce insulin or send insulin to the rest of your body, later leading to the development of diabetes. The tube that carries bile from your liver and gallbladder to your small intestines may become blocked and inflamed, leading to liver problems and sometimes gallstones. Intestinal obstruction can happen to people with cystic fibrosis at all ages and is more likely to affect infants by developing intussusception, which is a condition where the intestines folds in onto itself like an accordion. And last is distal intestinal obstruction syndrome. This is partial or complete obstruction where the small intestine meets the large intestine.